Okay, so I'm going to continue going through the forms that you receive at your pre-op appointment. This one, you've seen this before. These are our new patient forms. And in here has your demographics. It has some HIPAA authorizations, things like that. And it also has the most important one, which is your health and history, your review systems. The reason that we give this to you again, because patients come in, they're like, I'm not a new patient, I've already filled these out. Yes, you did. You did fill these out. Thank you very much for filling them out. But we are required, remember this Quad A thing? We are required to collect, for patient safety reasons, we need an updated health history before we can operate on you. So many times our patients come in and they had their consultation, like 5 months ago? And they're booking their surgery 3, 4, 5 months out, depending on how busy we are. So it's a long time. So things can happen, things can change. You could, in that interim time, you could get diagnosed with, something. So we want the opportunity to review your health history again to make sure that there's nothing that we need to be on the lookout for. With that, you know what? I should have grabbed something. Hold on. Okay, so based on that health history, whatever you select on here, I'm glad I thought of this because people ask this all the time. That tells us what pre-op labs and things you need to do. So this is one of the hospital's forms. It's one of the hospital's forms, but we use the same anesthesia practice that they do. So this is anesthesia's form, but I've got their copy. Basically it's the same protocol as what the hospital's doing is what we do as far as pre-testing. They say that, I'll show you. They tell us what tests we need depending on what you have going on. So if you're a female over 55, you need, EKG. If you are a female 12 to 55, there's some exceptions, we have to do a pregnancy test. That we do here. We actually do that really kind of on everybody. If you're diabetic, we need a BMP, glucose day of service, and then an EKG. If you have hepatitis, we need, so this is telling us what pre-op labs you need. We are looking at your health and history form to determine what we need to check prior to surgery. The other thing is medical history can tell us what you need. So if you are diabetic, we also need a CBC, and we need a BMP, and we need a A1C, the hemoglobin A1C. We gotta make sure it's within a certain range. So you can have surgery if you are diabetic, if you have kidney disease, if you have hypertension, CV disease, bleeding disorders. You can have surgery if you are managing this, and your labs show that you are well managed with underlying conditions. Having these things, please don't leave them off of your surgery forms. It does not mean that you can't have surgery. It just means that we need to check a few things first. No big deal. So patients call all the time and they're like, oh, well, you don't need my, I'm 30 years old. You don't need my EKG. You don't need my chest x-ray. Dr. So-and-so down the street made me do it. Well, any doctor can, ask for whatever they want, but we go by what anesthesia requires. A lot of our patients are cash pay. We're not sending them for unnecessary tests. If you want to go get a physical before, then you can do that. I did, I did because I like, I always want to be safe, but that's up to you. But these are what we require. This is what anesthesia requires. So, these forms are going to ask you all those questions. And yes, you did already fill this out. You filled this out at your consultation, but we need it again because your consultation may have been 3 months ago.